My name is Alessandra. I am 35 years old and I discovered that I inherited a BRCA1 mutation. Sadly, my mother in 2020, during the COVID period, discovered to have breast cancer, and it was somehow kind of a surprise because in our family, sadly, we had cases of cancer in the past, but not breast cancer specifically. The doctors, they recommended that I get tested. I took my time to get tested, I have to say, a little bit, because during the COVID, access to healthcare was not so smooth as in normal times, but also because, I knew that I had to do it, but I was not in a rush, because after all, I was in my early 30s, we never had cases of breast cancer in the family. My mother got sick when she was 60, so it was something that I knew that I was supposed to do, but still I didn't feel this kind of urgency. Well, luckily I got tested and I started to, let's say, follow the protocol of visits and so on, because one of the first visits I did after the testing, I discovered to have breast cancer myself, and that was a huge surprise because I was in my early 30s. I remember it was last year. Honestly, I didn't have any symptoms. I felt very good. I hit the gym 3 times per week, which for me is a nice achievement. So I would have never expected to have breast cancer at that age. I remember that I had mixed feelings when I got the results of the genetic test. On the one hand, I felt very lucky and privileged because I knew that I could act, I could do visits to prevent breast cancer and so on. So I felt very lucky compared to many people that maybe don't know about their genetic condition until they develop a disease. Emotionally speaking, I must admit that it was quite different because it was quite tough for me, because I have always been healthy my entire life. I've never been to a hospital, I've never had a surgery. So the thought of having to go to the hospital every 6 months to check my breast, to do an IRM once per year, to have to eventually decide to go for a mastectomy, it was a lot for me. I must admit that it took some time for me to accept, let's say, my situation of genetically mutated person. If I think now about my feelings back then, it's like I was rejecting a bit the situation, and this changed a lot. My perspective changed a lot when I developed breast cancer myself, because then it clicked. I started to touch the risk of what it means to have a genetic mutation. After the diagnosis, I instead decided to go for it immediately, as soon as I recovered for the chemotherapy. I did the surgery, it's almost 1 year now, because it was September last year, and I have to say that I am super happy. I am very satisfied. I remember when I woke up from the anesthesia, that even if I was feeling very weak, I looked at my breast and I saw them, and I was like, oh, I felt so peaceful, because I was like, okay, now it's done. What I can say for people that are hesitant about perhaps taking the test or undergoing a mastectomy with reconstruction. So first of all, everybody is different. Everybody have their own preference. As a person, you have the right to choose what you want to do with your body, with the support, of course, of healthcare professionals and so on. What I can say about my situation? Well, if I didn't get tested, I would have not started my visits for preventing breast cancer, and if I didn't have my visits regularly, I would have not detected my cancer in time. I mean, I know that it can be scary. I know that it can be a life-changing decision. I know that sometimes when things scare us, we have the tendency to procrastinate them. I did it myself. But consider the benefit, what it can do for you, something like that. Because of course, getting a genetic diagnosis is a life-changing event, but it gives you back control on your life. So, with the BRCA1 mutation, you become more at risk of developing breast cancer, but also ovarian cancer. So, in my case, with the breast, I did what I was supposed to do, let's say, or at least what I wanted to do. So, I did the mastectomy with reconstruction and so on. Now, let's talk about the ovaries. So, in my family, we never had cases of ovarian cancer. However, I know that with my genetic condition, I am at risk of developing it. And I was also informed by the healthcare professional that, contrary to the case of the breast, the echography and this kind of screenings are not as effective to prevent cancer. So I have decided to remove my fallopian tubes. So I'm undergoing this surgery in the next weeks. So I don't know yet how this is going to be, but I am hopeful that it's going to be very smooth. As regards my experience with the mastectomy with reconstruction, I must admit that at the beginning I was very scared because I've never had a surgery before. So, and this is a kind of big surgery because it lasts something like, 7 hours or something like that. So that was huge. However, I can say that after I did the surgery, I felt very much relieved. I was a bit scared of the change in perception of my body because I asked the plastic surgeon to try to keep the situation as it was because I really liked my breasts, to be honest, and I didn't really want to change anything with them. So yeah, I managed to recover it quite soon. And also sports-wise, I was a bit scared that I would have not been able to do sports again as before, but actually I even started running, something that before I was not even doing. And also with yoga, I was scared that a certain position would have been off limits for me, but actually no, I think that I totally recovered my mobility compared to beforehand. I am in a relationship, my partner, we have been together and we went through my genetic test result and also my breast cancer diagnosis and my treatment together. As regards the genetic test diagnosis, it was an important diagnosis for us. However, he has always been very supportive during my during my treatment of breast cancer as well. For people who are hesitant whether to undergo a mastectomy with reconstruction or also without reconstruction, because there are also people who decide to do the mastectomy without reconstruction, the first thing I would recommend is listen to your doctor. But the second thing I would recommend is try to speak with somebody who underwent this procedure. Because doctor, of course, they are medical professional, it's their job to give you medical advice, but they do not necessarily undergo the procedure themselves. So finding a patient association, finding somebody who decided to do that and so on, this could really help because you can chat, you can discuss things that with your medical professional probably you would not be able to exchange about. For me, for example, talking with people who underwent the mastectomy was very helpful because it helped me to prepare psychologically. And I think psychological preparation for this kind of surgery is important because it's gonna change your body.